Hi sir, my name is Oi Yuan, metric number 262543. In this video, I'm going to present the field testing report. My project title is UM Staff Health Profile Mobile Application. For the overview of the application, UM Staff Health Profile Mobile Application is used to document the individual health profile of each UM staff so that it can serve as a reference for healthcare professionals. This application also enables UM staff to view all of their past record of medical checkup information, highlight any health issue of UM staff, and remind UM staff for the next medical checkup. This project would involve two individuals, which are UM staff and UM healthcare professionals. UM staff will log in as the role of user in this application to review their medical checkup record and to be reminded for the next body checkup. And for the UM healthcare professional, they will log in as admin to record the health profile of a patient and other data. This project is intended to maximize the productivity of UM healthcare professionals in clinical practice and also strengthen the healthcare of UM staff. For the evaluation method, the type of evaluation conducted to evaluate the application was unmoderate remote usability testing, which is URUT. For the objective of the evaluation, first, to determine whether the application user interface is user-friendly or not. And then next, to identify the usability of the application. In addition, to identify the user satisfaction of the application. And lastly, to identify the usefulness of the application. For the participants, a total of 32 of respondents were recruited for the study. Among the respondents, only 9 of them were healthcare professionals. Healthcare professionals were in charge of evaluating the application for the admin position, while the non-healthcare professionals were in charge of evaluating the application for the registered user. In terms of gender, 17 of the respondents were female, while the rest were male. Then when it comes to age, 24 of them were between the age of 21 and 25, 3 were between the age of 26 and 30, 3 of them were between the age of 31 and 35, and 2 of them were beyond 35 years old. Furthermore, 22 of the respondents were students, 1 of them was staff, and 9 of them were classified as other than student and staff. In terms of education, 25 of the respondents were at the bachelor level, 4 of them at the STPM level, 2 of them at the diploma level, and 1 of them at the SPM level. While for the ethnicity, 28 of the respondents were Chinese, 2 were Malay, and 2 were Indian. Finally, 24 of the respondents has previously undergone a medical checkup. The majority of them, which is 19 of the respondents, have their medical checkup once a year. 10 of them never have a medical checkup before, 2 of them have their medical checkup twice a year, and 1 of them has their medical checkup more than 3 times a year. The respondents were mostly recruited through the distribution of questionnaire via the WhatsApp application. For the materials, the instruments and assessment items used for the evaluation include the UM Staff Health Profile Mobile Application, which is both application for user and admin. And then next, Google Form, which is for questionnaire purpose. And lastly, a set of questions of system usability scale. And then we move to the procedure for conducting the evaluation. The evaluation begins with the creation of a questionnaire for data collection. The questionnaire questions were generated from the 3 software quality attribute perspective, which are user interface, aesthetic, usefulness, and ease of use. The question for the software quality attribute of user interface aesthetic were generated based on the degree to which a user interface of the application allows for present and satisfying interaction. Next, the question for the software quality attribute of usefulness were generated based on the learnability of the application, which is the degree to which a product or system can be utilized by specific user to achieve specific goal of learning to use the product or system with effectiveness, efficiency, risk-free, and satisfaction in a specific context of use. Lastly, the question for the software quality attribute of ease of use were generated based on following sub-characteristics. The first sub-characteristic is recognizability of appropriateness, which is the degree to which user can recognize if a product or system is appropriate for their needs. And next, operability, which is the degree to which a product or system contains attributes that make it simple to use and control. The questionnaire was created in Google Forms and distributed to the public via the WhatsApp messaging apps. Before answering the questionnaire, a respondent must download and utilize the application. The sort of application downloaded by the respondent is determined by whether they are healthcare professionals or not. Healthcare professionals were in charge of evaluating the application for the admin position, while the non-healthcare professionals were in charge of evaluating the application for the registered user. This questionnaire was designed to evaluate the usability of the Staff Health Profile application by soliciting feedback on the application user experience. Next, we move to the result and finding. We take a look on the result of the questionnaire. The questionnaire that shown on the screen now is questionnaire of application for user side. So the first part of the questionnaire is user interface evaluation. First question is, does the application interface design look nice and attractive? According to the bar chart above, 15 respondents agree, 5 respondents extremely agree, and 3 respondents were neutral about it. Next, for the question, does the application interface pleasant to use? 16 respondents agree, 5 respondents extremely agree, and 2 respondents were neutral about it. And then for the question, do the feature and information presented look neat and tidy? 15 respondents agree, 5 respondents extremely agree, and 3 respondents were neutral about it. And then for the question, does the application screen sequence make sense? 13 respondents agree, 8 respondents extremely agree, and 2 respondents neutral about it. Next, for the question, does the application user-friendly and can be easily used without any written instruction? 14 respondents agree, 8 respondents extremely agree, and 1 respondent disagree. Next, we move to the next part of the questionnaire, which is the usefulness evaluation. For the question, does the application make it easy for you to view the medical checkup report? 16 respondents agree, 5 respondents extremely agree, and 2 respondents neutral about it. Next, for the question, does the application save your time in viewing the medical checkup reports? 12 respondents agree, 8 respondents extremely agree, 2 respondents neutral about it, and 1 respondent disagree. Next, we move to the next question, which is, does the application enhance your effectiveness in viewing the medical checkup reports? 10 respondents agree, 10 respondents extremely agree, and 3 respondents neutral about it. So next, for the question, does the application helpful in identifying any health issue in the medical checkup reports? 13 respondents agree, 10 respondents extremely agree. And then for the question, does the application save your time when it comes to checking for the next medical checkup? 14 respondents agree, 8 respondents extremely agree, and 1 respondent disagree. And then for the question, does the application have all the function and capability that you expect to have? 11 respondents agree, 10 respondents extremely agree, 2 respond neutral about it. And next, for the question, does the application perform as expected? 11 respondents agree, 7 respondents extremely agree, and 5 respondents were neutral about it. And then for the question, does the application useful overall? 12 respondents agree, 7 respondents extremely agree, 2 respondents neutral about it, and 2 respondents disagree. And then we move to the next part of the questionnaire, which is the ease of use evaluation. So for the first question of ease of use evaluation, does the application easy to use? The 10 respondents agree, 9 respondents extremely agree, and 1 respondent were neutral about it. Next, for the question, does the application easy to use without written instruction? The 10 respondents agree, 6 respondents extremely agree, and 4 respondents neutral about it. Then for the question, can you easily remember how to use the application? 12 respondents agree, 10 respondents extremely agree, and 1 respondent disagree. Next, for the question, are you satisfied with how easy it is to use this application? 14 respondents agree, 7 respondents extremely agree, and 2 respondents were neutral about it. And next, for the question, would you continue to use the application? 12 respondents agree, 9 respondents extremely agree, and 2 respondents were neutral about it. And then for a question, would you recommend the application to your friend? 10 respondents agree, 10 respondents extremely agree, 2 respondents neutral, and 1 respondent extremely disagree about it. And then we move to the another questionnaire, which is the questionnaire for the application of admin site. So the first part of the questionnaire also the same, which is the user interface evaluation. So the first question is, does the application interface design look nice and attractive? 4 respondents agree, 3 respondents were neutral, and then 2 respondents extremely agreed about it. Next, for the question, does the application interface pleasant to use? 5 respondents extremely agree, 4 respondents agree about it. Next, for the question, do the feature and information presented look neat and tidy? 3 respondents extremely agree, 3 respondents agree, and 3 respondents were neutral about it. And then next, for the question, does the application screen sequence make sense? 4 respondents extremely agree, 3 respondents agree, and 2 respondents were neutral about it. Next, for the question, does the application user-friendly and can be used without any written instruction? 6 respondents extremely agree, 3 respondents agree about it. And then we move to the next part of the questionnaire, which is the usefulness evaluation. So the first question is, does the application make it easy for you to record the medical checkup report? 7 respondents agree, 1 respondent extremely agree, and 1 respondent neutral about it. Next, for the question, does the application save your time in recording the medical checkup report? 6 respondents agree, and 3 respondents extremely agree about it. Next, for the question, does the application enhance your effectiveness in recording the medical checkup report? 5 respondents extremely agree, and 4 respondents agree about it. Next, for the question, do the various functions in this application were well integrated? 5 respondents neutral, 3 respondents extremely agree, and 1 respondent agree about it. And then for the question, does the application have all the function and capability that you expect it to have? 6 respondents agree, and 3 respondents were neutral about it. Next, for the question, does the application perform as expected? 5 respondents agree, 3 respondents extremely agree, and 1 respondent were neutral about it. Then for the question, does the application useful overall? 8 respondents extremely agree, and 1 respondent agree about it. Then next, we move to another part of the questionnaire, which is the ease of use evaluation. So first question is, does the application easy to use? 6 respondents extremely agree, and 3 respondents agree about it. Next, for the question, can you easily remember how to use the application? 7 respondents extremely agree, 1 respondent agree, and 1 respondent were neutral about it. Next, for the question, does the application unnecessarily complex? 5 respondents disagree, 3 respondents extremely disagree, and 1 respondent agree about it. Next, for the question, do you require the assistance of a technical person to be able to use this application? 6 respondents extremely disagree, 1 respondent disagree, 1 respondent neutral, and 1 respondent agree about it. Next, for the question, do you think that most people will learn to use this application very quickly? 7 respondents agree, and 2 respondents extremely agree about it. Next, for the question, does the application very cumbersome to use? 6 respondents extremely disagree, 2 respondents disagree, and 1 respondent agree about it. Next, for the question, do you think that you need to learn a lot to get started with this application? 8 respondents extremely disagree, and 1 respondent agree about it. Next, for the question, are you satisfied with how easy it is to use this application? 5 respondents extremely agree, and 4 respondents agree about it. Next, for the question, would you like to use this application frequently? 6 respondents agree, and 3 respondents extremely agree about it. Next, for the question, will you recommend the application to your friends? 5 respondents agree, and 4 respondents extremely agree about it. Lastly, we move to the implication of the result. According to the result that I showed just now, the majority of the respondents feel that the application overall performed a decent job in terms of user interface statistics. It's only that a small number of respondents think that the application for the registered user isn't user-friendly and can't be easily used without written instruction. This scenario occurs maybe due to the identical design of an unpressable title and button, which cause some user confusion. This issue can be solved by redesigning the title and buttons or by separating the unpressable title and buttons with a different color so that the application data is presented in a more neat manner. Next, in terms of usefulness, the majority of respondents felt that the application were high usability. Only a small number of respondents think that the application for registered user does not save their time in viewing the medical checkup report as well as checking their next medical checkup. This situation arises mostly because some of the respondents do not get their medical checkup on a regular basis. Thus, they did not find the application useful and convenient. Lastly, in terms of ease of use, the majority of the respondents were satisfied with the application and felt that it was easy to use. However, when it comes to the application for user, a small number of respondents think that they can't easily remember the application operation. This problem emerged mostly as the result of a lack of detailed instruction for user on how to use the application. This problem can be overcome by providing a step-by-step instruction at the beginning to teach user how to utilize the application. While when it comes to the application for admin, a small number of respondents think that the application was very cumbersome to use. This scenario occurs mainly due to the nature of the handheld device small screen and restricted bandwidth. It is unlikely to record an overwhelming amount of information on a single screen. This problem can be overcome by converting some of the text field into a multiple choice, drop-down, and checkbox option to facilitate the recording of the medical checkup report. So this is all from my presentation. Thank you.